Hi, I'm Tim Ehrlich, and I'm a surgeon who has dedicated over the last decade to the field of weight loss surgery. People don't normally think of obesity as a disease. My goal is to convince you that it is. A disease is actually defined as a chronic medical condition or impairment of the body or one of its parts resulting from various causes, characterized by a definable group of signs and symptoms. Okay, well, let's break it down a little bit. An impairment of the body. Besides the obvious physical manifestations of obesity wreaks havoc on your insides from hormonal to cellular to organ disruption, resulting from various causes. Stress, genetics, environmental factors, these are just the few components that can lead to obesity. Defined by a group of signs or symptoms: joint pain, weight gain, abnormal menses, shortness of breath, well, the list is endless. Years of research on family and twin studies have found 32 genes that are influential to obesity from each parent, totaling 64 possibilities for a genetic predisposition. And though an unhealthy diet and lack of physical activity can be a contributing factor to the development of obesity, we don't blame or deny treatment to patients with cancer, hypertension, or diabetes, whose disease process can also be due to their diet or lack of activity. If you have hypertension, we give you a bunch of pills and hope your blood pressure comes down. If you have colon cancer, we take out the cancer, maybe give you chemotherapy or radiation, and we hope. But man, is obesity different. And though the causes of obesity are multifactorial like most diseases, no other group of patients experience the hurdles, the ridicule, and the punishment that the obese patient does. No other disease is associated with so much shame and loneliness. We support people with other diseases. We should also support those with obesity. Weight discrimination has increased 60% throughout the last decade, and healthcare providers have been shown to be among the worst offenders time and time again. But we also feel ill-prepared to treat obesity. The stark reality is that obesity is associated with almost every disease that we know, from head to toe. Almost all cancers are strongly associated with obesity, and studies have shown up to a 60% risk reduction of the more common cancers with weight loss surgery. So how can we not see this as a disease? We need to treat any patient with the same empathy and the same depth of compassion as we would any patient with a truly chronic disease. We cannot judge, and we need to learn to put our own fear of obesity or our prejudices aside. Easier said than done. But click here so we can have the pleasure and opportunity to educate you in a judgment-free zone about the interventions that can truly add years to your life and help eradicate the obesity epidemic. Thank you for your time.